হ্যালো ফিউচার নার্সেস, ওয়েলকাম ব্যাক টু মাই চ্যানেল নার্স প্রফেশন বাংলা। আজকের প্রথম কোশ্চেন হচ্ছে দ্য মোস্ট কমন কজ অফ পোস্টপার্টাম হেমোরেজ, ট্রমা, রিটেন্ড প্লাসেন্টা, ইউটেরাইন অ্যাটনি, কোয়াগুলোপ্যাথি। Answer: uterine atony. Uterine atony means failure of the uterus to contract after delivery, leading to continuous bleeding from the placental side. It is the most common cause of postpartum hemorrhage. Question 2. The first stage of labor ends with onset of contraction, full cervical dilatation, delivery of fetus, delivery of placenta. Answer: full cervical dilatation. The first stage of labor begins with the true labor pains and ends with the cervix is fully dilated 10 cm, allowing passage of the fetus into the birth canal. 3. The most common presentation at term is breech, shoulder, cephalic, transverse. Answer: cephalic. In cephalic presentation, the fetal head presents first. It is the most common and safest presentation for normal vaginal delivery. Question 4. The hormone responsible for maintaining pregnancy is estrogen, progesterone, oxytocin, prolactin. Answer: progesterone. Progesterone maintains pregnancy by keeping the uterus relaxed, preventing contractions, and supporting endometrial lining for fetal development. 5th, what is the normal fetal heart rate? 100 to 120, 110 to 160, 120 to 180, 140 to 200. Answer: 110 to 160 beats per minute. Normal fetal heart rate ranges from 110 to 160. Values outside the range indicate fetal distress, tachycardia or bradycardia. 6. What is the most common cause of antepartum hemorrhage? Placenta previa, abruptio placenta, uterine rupture, trauma. Answer: placenta previa. Placenta previa is the most common cause of antepartum hemorrhage, characterized by implantation of the placenta in the lower uterine segment. It leads to painless vaginal bleeding in late pregnancy. 7. Fundal height at 20 weeks corresponds to symphysis pubis, umbilicus, xiphisternum, below umbilicus. Answer: umbilicus. At 20 weeks of gestation, the uterine fundus reaches the level of umbilicus. This is an important clinical landmark used to estimate gestational age. The first fetal movement felt by mother is called engagement, quickening, lighting, ballotment. Answer: quickening. Quickening refers to the first perception of fetal movement by the mother, usually felt between 16 to 20 weeks of pregnancy. 9. What is the most common type of pelvic shape? Android, gynecoid, anthropoid, platypaloid. Answer: gynecoid. Gynecoid pelvis is the most common female pelvis type and is ideal for vaginal delivery due to its rounded inlet and adequate dimension. Question 10. The Apgar score is assessed at 1 and 5 minutes, 2 and 10 minutes, 5 and 15 minutes, 10 and 20 minutes. Answer: 1 and 5 minutes. Apgar score is evaluated at 1 minute initial adaptation and 5 minute response to resuscitation after birth to assess newborn condition. 11. The most common complication of preeclampsia is hemorrhage, eclampsia, infection, shock. Answer: eclampsia. Eclampsia is the progression of preeclampsia characterized by seizure due to severe hypertension and cerebral edema. It is the most serious and common complication. Which is the drug of choice for eclampsia? Diazepam, magnesium sulfate, phenytoin, oxytocin. Answer: magnesium sulfate. Magnesium sulfate is the drug of choice as it prevents and controls seizure in eclampsia by depressing the central nervous system. 13. Placenta previa prevents with painful bleeding, painless bleeding, fever, edema. Answer: painless bleeding. Placenta previa typically presents with sudden, painless, bright red vaginal bleeding in the late pregnancy due to placental placement in the lower uterine segment. 14. What is the normal amniotic fluid volume at term? 200 ml, 500 ml, 1000 ml, 2000 ml. C. Answer C. 1000 ml. At term, the normal amniotic fluid volume is approximately 800 to 1000 ml, which helps in fetal movement, protection, and temperature regulation. 15. Which is the most common site of fertilization? Uterus, ovary, fallopian tube, cervix. Answer C. Fallopian tube. Ampulla. Fertilization most commonly occurs in the ampulla of the fallopian tube, where sperm meets the ovum after ovulation. 16. Which is the most fertile period in menstrual cycle? Day 1 to 5, day 6 to 10, day 11 to 17, day 20 to 25. Answer day 11 to 17. Ovulation occurs around day 14 in a 28-day cycle. The fertile window includes a few days before and after ovulation, when chances of conception are highest. 17. What is the normal menstrual cycle length? 21 to 35 days, 15 to 20 days, 10 to 15 days, 40 to 50 days. Answer 21 to 35 days. A normal menstrual cycle ranges from 21 to 35 days in adult, with an average of 28 days, reflecting regulate hormonal function. Question 18. Which is the most common benign tumor of uterus? Fibroid, polyp, cyst, carcinoma. Answer fibroid. Uterine fibroid are the most common benign tumors, arising from smooth muscle of the uterus and often causing menorrhagia or pressure symptoms. 19. Which is the screening test for cervical cancer? Biopsy, pap smear, ultrasound, MRI. Answer pap smear is a simple screening test used to detect precancerous and cancerous changes in cervical cell, enabling early diagnosis. 20. Which is the most common symptom of ectopic pregnancy? Pain, abdomen, fever, vomiting, headache. Answer pain in abdomen. The most common symptom is lower abdominal pain due to tubal distension or rupture, often associated with amenorrhea and vaginal bleeding. 21. Which is the most common site of ectopic pregnancy? Ovary, cervix, fallopian tube, abdomen. Answer fallopian tube. Around 95% of ectopic pregnancies occurs in the fallopian tube, most commonly in the ampulla, due to delayed transport of the fertilized ovum. 22. The safest period for intercourse in pregnancy is first trimester, second trimester, third trimester, entire pregnancy. Answer second trimester. The second trimester is considered safest as the risk of miscarriage and preterm labor is minimal and the mother is more comfortable. 23. What is the most common cause of infertility in women? Tubal block, hormonal imbalance, infection, fibroid. Answer hormonal imbalance. Hormonal imbalance, especially ovulatory disorders, example anovulation, is the most common cause affecting normal egg release. 24. What is the function of oxytocin? Milk production, uterine contraction, ovulation, menstruation. Answer uterine contraction. Oxytocin stimulates uterine contractions during labor and also helps in milk ejection, let down reflex after delivery. What is the normal pH value of vagina? 4 to 4.5, 6 to 7, 7 to 8, 8 to 9. Answer 4 to 4.5. Normal vaginal pH is acidic due to lactobacilli, which helps prevent infection by inhibiting growth of harmful organisms. 26. Which is the most common infection in pregnancy? UTI, TB, HIV, malaria. Answer UTI. Urinary tract infection is most common due to hormonal changes progesterone causing urinary stasis, and pressure of the enlarging uterus increasing risk of bacterial growth. 27. Which is the most common cause of maternal mortality? Infection, hemorrhage, hypertension, anemia. Answer: hemorrhage. Hemorrhage, especially postpartum hemorrhage, is the leading cause of maternal death due to rapid blood loss leading to shock if not managed properly. 28. The normal weight gain in pregnancy is 5 kg, 8 kg, 10 to 12 kg, 20 kg. Answer: 10 to 12 kg. Normal weight gain in a healthy pregnancy is about 10 to 12 kg, which supports fetal growth, placenta, amniotic fluid, and maternal tissue changes. Question 29. Which is the most common type of abortion? Threatened, missed, spontaneous, septic. Answer: spontaneous. Spontaneous abortion, miscarriage, occurs naturally without intervention and is the most common type, usually due to chromosomal abnormalities. 30. The first immunization in pregnancy is BCG, TT, OPV, hepatitis B. Answer: TT, tetanus toxoid. TT vaccine is given during pregnancy to protect both mother and newborn from tetanus, usually in 2 doses during antenatal period. 31. What is the most common cause of anemia in pregnancy? Vitamin B12 deficiency, iron deficiency, blood loss, infection. Answer: iron deficiency. Iron deficiency anemia is most common due to increased iron demand for fetal growth and expansion of maternal blood volume during pregnancy. 32. Which is the presenting part of vertex presentation? Face, brow, occiput, chin. Answer: occiput. In vertex presentation, the head is flexed and the occiput, back of the head, presents first, which is the most favorable for normal delivery. 33. What is the most common cause of neonatal death? Infection, prematurity, trauma, congenital anomaly. Answer B. Prematurity. Prematurity is the leading cause due to underdeveloped organs, especially lungs, leading to complications like respiratory distress. 34. What is the best indicator of fetal well-being? Movement, heart rate, weight, length. Answer B. Heart rate. Fetal heart rate monitoring is the most reliable indicator of fetal well-being and helps detect fetal distress early. 35. What is the most common cause of oligohydramnios? Diabetes, hypertension, renal agenesis, infection. Answer C. Renal agenesis. Renal agenesis leads to decreased fetal urine production, which is the main source of amniotic fluid, resulting in oligohydramnios. Question 36. What is the most common cause of polyhydramnios? Diabetes, anemia, infection, hypertension. Answer A. Diabetes. Maternal diabetes leads to fetal hyperglycemia and polyuria, increasing amniotic fluid volume, making it the most common cause of polyhydramnios. 37. The Bishop score is used for fetal growth, labor induction, placenta position, amniotic fluid. Answer: labor induction. Bishop score assesses cervical readiness, dilatation, effacement, station, consistency, position to predict success of labor induction. 35. Which is the most common indication for caesarean section? Fetal distress, breech, CPD, placenta previa. Answer C. CPD. Cephalopelvic disproportion. CPD occurs when the fetal head is too large or maternal pelvis is inadequate, preventing normal vaginal delivery, making it the most common indication for C-section. 39. What is the most common type of uterine fibroid? Submucous, intramural, subserous, pedunculated. Answer B, intramural. Intramural fibroids arise within the uterine wall and are the most common type, often causing heavy menstrual bleeding. 40. Which hormone is responsible for lactation? Estrogen, progesterone, prolactin, oxytocin. Answer C, prolactin. Prolactin stimulates milk production in the mammary glands while oxytocin helps in milk ejection. 41. What is the normal duration of lochia? 1 week, 2 weeks, 4 to 6 weeks, 10 weeks. Answer C, 4 to 6 weeks. Lochia is the postpartum vaginal discharge that normally continues for 4 to 6 weeks, progressing from lochia rubra to serosa to alba. 42. What is the most common cause of dysmenorrhea? Infection, endometriosis, prostaglandins, tumor. Answer C, prostaglandins. Increased prostaglandins levels cause uterine contractions and pain, making it the most common cause of primary dysmenorrhea. 43. Which is the most common type of ovarian tumor? Epithelial, germ cell, stromal, metastasis. Answer, epithelial. Epithelial tumors, example serous, mucinous, are the most common ovarian tumors, especially in adult women. 44. Which is the most common symptom of menopause? Bleeding, pain, hot flashes, fever. Answer C, hot flashes. Hot flashes are the most common symptom due to decreased estrogen affecting hypothalamic temperature regulator. Which is the most effective contraceptive method? Condom, OCP, IUCD, sterilization. Answer, sterilization. Sterilization, tubectomy, vasectomy is the permanent method with the highest effectiveness and minimal failure rate. 46. What is the use of copper T? Preventing ovulation, killing sperm, preventing implantation, all of the above. Answer D, all of the above. Copper T primarily creates a spermicidal environment and prevents fertilization. It also alters endometrium, preventing implantation. 47. Which is the most common STI? HIV, syphilis, gonorrhea, HPV. Answer D, HPV. Human papillomavirus is most common sexually transmitted infection worldwide, often associated with cervical cancer. 48. What is the most common cause of postmenopausal bleeding? Cancer, atrophy, infection, fibroid. Answer B, atrophy. Endometrial vaginal atrophy due to low estrogen is the most common cause of postmenopausal bleeding. 49. What is the most common cause of uterine rupture? Trauma, previous cesarean scar, infection, fibroid. Answer B, previous cesarean scar. A previous cesarean section scar weakens the uterine wall, making it the most common risk factor for rupture during labor. Question 50. What is the normal duration of pregnancy? 240 days, 260 days, 280 days, 300 days. Answer, 280 days. The normal duration of pregnancy is 280 days, 40 weeks, calculated from the first day of the last menstrual period. It is divided into 3 trimesters of about 3 months each. Thank you for watching and subscribe Nurse Profession Bangla.